Here are 4 high-yield USMLE-style questions focused on elastin, Marfan syndrome, homocystinuria, and related concepts. Question 1. A 15-year-old boy presents with tall stature, long extremities, and hypermobile joints. Physical examination reveals pectus excavatum, arachnodactyly, and a systolic murmur. Genetic testing reveals a mutation in the FBN1 gene. What is the most likely diagnosis? A. Homocystinuria. B. Marfan syndrome. C. Ehlers-Danlos syndrome. D. Osteogenesis imperfecta. E. Sickle cell disease. Answer: B. Marfan syndrome. Explanation: this patient is presenting with characteristic features of Marfan syndrome, which is caused by a mutation in the FBN1 gene, resulting in defective fibrillin 1. Fibrillin 1 is a glycoprotein that is essential for the elasticity of connective tissue, including elastin fibers. Marfan syndrome is characterized by tall stature, long limbs, pectus deformities, arachnodactyly, aortic root dilation, and mitral valve prolapse. The systolic murmur suggests a possible mitral valve prolapse or aortic insufficiency. Question 2. A 30-year-old woman presents with progressive shortness of breath, chronic cough, and wheezing. Physical examination reveals signs of emphysema. Her laboratory results show a deficiency in IF1 antitrypsin. Which of the following is most likely to occur due to this deficiency? A. Excessive breakdown of elastin in the lungs. B. Excessive collagen deposition in the lungs. C. Defective fibrillin 1 in the blood vessels. D. Excessive collagen deposition in the skin. E. Defective cross-linking of collagen. Excessive breakdown of elastin in the lungs. Explanation: AT1 antitrypsin deficiency results in unopposed elastase activity, leading to excessive breakdown of elastin in the lungs. Elastin is a protein responsible for the elasticity of the lungs, and its degradation leads to emphysema and chronic obstructive pulmonary disease, COPD. Normally, AT1 antitrypsin inhibits elastase, an enzyme that breaks down elastin. In AT1 antitrypsin deficiency, this protective mechanism is impaired. Question 3. A 6-year-old boy presents with tall stature, hyperextensible joints, and fair complexion. He has a history of scoliosis and lens dislocation. His family history reveals similar symptoms. Genetic testing confirms a mutation in the cystathionine synthase gene. What is the most likely diagnosis? A. Marfan syndrome. B. Ehlers-Danlos syndrome. C. Homocystinuria. D. Osteogenesis imperfecta. E. Sickle cell disease. Answer: C. Homocystinuria. This patient is most likely presenting with homocystinuria, a recessive genetic disorder caused by a deficiency in cystathionine synthase, leading to homocysteine buildup. Homocystinuria has a presentation similar to Marfan syndrome, including tall stature, hyperextensible joints, scoliosis, lens dislocation, which typically occurs downward nasal in homocystinuria, compared to upward temporal in Marfan syndrome, and fair complexion. Marfan syndrome is autosomal dominant, while homocystinuria is autosomal recessive. Question 4. A 35-year-old man with Marfan syndrome presents for a follow-up. He is concerned about his aortic root dilation, which is a common complication of his condition. Which of the following best describes the underlying cause of this complication? A. Defective elastin cross-linking due to a mutation in the FBN1 gene. B. Excessive collagen deposition in the aortic wall. C. Defective fibrillin 1, leading to abnormal TGF-beta sequestration. D. Excessive breakdown of collagen due to a deficiency in AT1 antitrypsin. E. Impaired cross-linking of glycosaminoglycans in the extracellular matrix. Answer: C. Defective fibrillin 1 leading to abnormal TGF-beta sequestration. Explanation: in Marfan syndrome, a mutation in the FBN1 gene leads to defective fibrillin 1, a key component of the elastic fibers in connective tissue. Fibrillin 1 normally sequesters TGF-beta, transforming growth factor beta, a growth factor that regulates tissue repair. When fibrillin 1 is defective, TGF-beta is unregulated, leading to abnormal remodeling of the aortic wall, including aortic root dilation and increased risk of aortic dissection. The defective elastin in Marfan syndrome results in weakened and dilated blood vessels. These questions focus on key features